Okay, so it should be recording now. So now I will turn it over to, I will stop sharing my screen and I will turn it over to Linda so she can, from the Center for Nonprofits, so she can start her presentation.
Thank you, Anna. Bear with me for one moment, folks. I think we're in business. Good afternoon, everyone, and thank you to Maria, Anna, and the rest of the Council of New Jersey Grantmakers team and the Council of New Jersey Grantmakers Board for the chance to share with you some of the observations that we're seeing and the input that we're getting from the nonprofit community during this very, very difficult time. I hope you all are keeping healthy, and I do want to thank you for being so responsive. I've seen the activity that has been happening already has been absolutely phenomenal. Before I start to dive in, I will just preface this by saying what you already know, which is things are changing rapidly. So, I'm going to talk a little bit about what we've been seeing, what the Center for Nonprofits has been doing, and again, welcome the chance to stay in close contact, and we're grateful for our partnership with the council that enables us to do that. Okay, I think you all know who the Center for Nonprofits is. We are the charitable umbrella organization for the nonprofit community, kind of the flip side to the Council of New Jersey Grantmakers. We work through advocacy, direct services to nonprofits, and a whole slew of other activities to strengthen the nonprofit community in our state. We're also part of a national network, which many of you are also familiar with, the National Council of Nonprofits, which is the network for state associations like ours across the country. And a lot of what I'm talking about, we do our work very, very closely in partnership with that network. I always like to just remind people, and I'm preaching to the choir on this call for sure, but why this even matters. We know, especially in times like this, how vital the services are and the programs are that nonprofits provide, making our lives better, providing essential programs and services. And again, this is stuff that you already know. I also think it's important, and this is also why this conversation is so important, that if we're talking about a strong, healthy New Jersey economically and socially, we also need a strong, healthy nonprofit community, because nonprofits are major employers, major consumers, part of what makes towns thrive, and municipalities and cities and whatnot. Again, as this pandemic was starting to unfold over just the last week, we partnered with the council to conduct what we call a rapid response survey of the nonprofit community to gauge what the effects have been so far, what nonprofits' concerns and needs are, and what might happen moving forward. To help to inform our decisions, this will certainly not be the last survey that we conduct, but we thank all of you for pushing this out to your grantees and your networks. Thanks to your actions, we got more than 700 responses within the span of a 5-day period, which is pretty phenomenal. And easily half of them put in open-ended responses. And we had a lot of open-ended questions, which I'll get to a little bit. But I'll give you on this presentation just kind of the 30,000 foot view with a little bit of specifics sprinkled in, and then we can hopefully have a conversation about some of the ways to move forward. Last caveat is, obviously from where we are, we have a certain vantage point. We don't pretend to know everything that's going on, and I know that you have been in close contact with your grantees and your partners and have much more to contribute, but this is just one view, and I'm looking forward to sharing it with you. So first thing, we asked about how badly the outbreak has been disrupting your programs and operations now, the current impact of the coronavirus on nonprofit programs and operations. And as you can see, 64% said it was already disrupting things significantly, and another 23% said they had already experienced moderate disruptions. So we're talking about 87% of our respondents. Now, when you think about what kinds of disruptions we're talking about things like canceled events, canceled programming, the need to change work habits, the challenges to keeping people safe, challenges to being able to serve vulnerable populations. Again, I'm sure these are things that you have already been hearing, but this has played out in a lot of ways, and it played out very, very quickly. We also asked, moving forward, how likely is it that your services and programs will be disrupted? And almost everyone said at least moderate or significant disruptions were likely to happen. And again, this takes a lot of different forms, both in terms of existing workforce as well as impact on programs, its impact on finances, um, multifaceted, as I know you are aware and have experienced. We asked immediately, what are some of the immediate steps you've been taken? And a lot of that, of course, affects day-to-day kinds of operations and changes in practices. Again, almost everybody said they had to reschedule or cancel some sort of program or event, and some of these are absolutely significant and comprise big parts of budgets, and we'll be talking about that in a little bit. Taking steps, of course, to stay informed through official channels in the media, making sure that you're trying to promote good, healthy practices to keep staff and clients safe, encouraging sick employees to stay at home where that's sharing guidance and the like. So a lot of this is day-to-day kind of stuff, revisiting work policies, updating sick leave policies, and of course more of this is coming into play as legislation comes down the pike. Work at home. It's really, really important to keep in mind that when we're talking about the nonprofit community, a lot of folks cannot work at home. That's not an option. Center for Nonprofits is working remotely. We are fortunate that we have the type of organization operation that, and frankly, the equipment to be able to do that. But because of the nature of their missions or for other reasons, nearly 2/3 of our respondents said that there were at least some of their positions where work at home was not an option. Think about things like nursing homes or emergency rooms or teaching staff. Our teaching staff cannot work at home. Our families don't have access to the internet. Domestic violence shelters, you go on and on and on, group homes, soup kitchens. So charities are there on the front lines providing these services, and some of the adjustments that our government officials are calling on us to make for public health reasons aren't an option for a lot of organizations. And again, we'd be remiss if we didn't point out that there is a significant equity component to this as well that I know you all are aware of, but it bears repeating. In terms of moving forward, what is going on? What kinds of impacts are concerning organizations? You look at the top bar here, 90% said, they're worried about the programs and events that they had to cancel. A lot of these folks said, this is the lion's share of our budget. We had to cancel our gala or our conference or, XYZ event that was going to be a significant portion of our budget. Our fiscal year ends June 30th. There's no way we can get that back. Some folks have pushed this back to the fall, but of course right now we don't know what's going to happen. So huge, huge concerns there on the financial and budgetary aspect. Disruption of services to clients and communities. Again, we kind of alluded to that, but you've got vulnerable people who need help. You need marginalized populations. There's an equity issue here, but there's also just an issue of being able to pursue mission in the face of this uncharted situation that we're all dealing with. Ancillary or secondary, kind of the next wave, budgetary implications related to strains on the economy. Obviously, this is hitting absolutely every sector, and what we also see, of course, from past economic downturns, and this is pretty unprecedented, but in the past, nonprofit community gets hit first and nonprofits recover last because everybody else needs to be stabilized before they feel comfortable giving, participating in different ways. And this means that services are demand for a lot of nonprofit services are going to spike. So we're talking about capacity issues, while at the same time where you might be dealing with increased absences because staff need their own personal health issues, or they need to care for loved ones, or simply because schools are closed, and there are any number of levels that this plays out. Toward the bottom, but not an insignificant amount, I want to call attention to this 30%. That's nearly a third of our respondents are concerned that they have to lay off staff, they have to furlough staff because they won't be able to meet their budgets, their revenues because of this crisis. One of the benefits of the long-standing partnership that we've had with the council and the work that we've done together with the council is the ability to have frank conversations about things that are going on. And I did want to make a point, and this is a conversation that we've been having for quite a long time with the council and many of its members. So this isn't news, but it's worth repeating. And when infrastructure investments are not made, and of course right now I'm talking about the nonprofit community, but this plays out of course in other aspects of our society in terms of service delivery and investment in important priorities, whether it's healthcare system or anything else. But I'm looking obviously at a nonprofit lens. There is a price to be paid when we underinvest. This slide is a screenshot of an article that came out over 10 years ago called The Nonprofit Starvation Cycle. I imagine many of you are familiar with it, but it raised the warning signs of what happens when nonprofits don't have the resources to invest in their own infrastructures, when they're starving themselves because overhead is underfunded, infrastructure is underfunded. Again, this is a familiar theme, but it bears repeating now because the effect of this is, and we've talked about this in our annual surveys for quite a long time, rising demand, rising expenses, and resources not keeping pace, and the resulting capacity gap chips away at nonprofit support systems. This slide is something that I've used in other presentations, and when you've got a good, well-funded, solid organization, the metaphor here is a Jenga tower, but you start to chip away at that by underfunding key critical components, and it may look okay by certain angles, but the infrastructure and the supports are starting to get weakened until all of a sudden the supports are not there. And the ability or inability in some cases of organizations to absorb the blunt of this catastrophe is in part a reflection of the decisions that have been made for years and the inability to fully fund the work of nonprofits. So I think it's important to just bear that in mind. And again, this is a conversation that we've had and the council has had, and many members of the council have been taking the lead on this for quite some time, but I do think it bears repeating. So what are nonprofits looking for? We asked nonprofits, what would you tell funders? What would you tell your donors? What would you tell government? And again, just to reiterate, we closed this survey on Tuesday, the 17th in the evening, and we have scrambled very hard to tabulate this in the best possible way, but there's always more coming. We will have more resources and more presentations to dive into this stuff with greater depth as we move forward, but this is kind of the preliminary stuff that have been coming out. So you can classify the feedback and the input according to a number of broad categories, but I will say some of the open-ended responses have been pretty gut-wrenching as far as what organizations are trying to confront. So these fall into a few different buckets: funding and resources, flexibility, stability, communications and information, partnerships, professional assistance, and of course there are many others that are specific to a particular field or sub-industry in the nonprofit community. Funding, and this is going to be stuff that I'm sure you have either heard elsewhere directly from your grantees or from folks on the national level. There are a number of articles and blogs and posts and by other key players that echo a lot of these themes. But first and foremost is funding. Nonprofits, especially because they've had to curtail, they're not looking at revenues that they were counting on, or nonprofits that in some cases are receiving government funds. They need the money quickly. They emergency funds, extra funds. The issue, another recurring theme, of course, is to try to extend the support that you're giving to your partners. If you've given restricted support, try to relax those restrictions, allow organizations to repurpose what some of the grants that you've given them. But again, breathing room and stability is absolutely key. And the other plea from multiple headquarters or from multiple quarters is look at your payout rate. This is not the time to scale back. Think very carefully and very hard about the concerns about marginalized, disenfranchised populations. Again, we've got a huge equity issue here as well. Many, many different ways in which this can play out. But your partners need you absolutely now more than ever. And I certainly acutely aware of the conversations we have with Congress about the fact that philanthropy can't fill the gaps, and government absolutely has a beyond critical role to play here. But there are also things that philanthropy can do. Flexibility, I kind of alluded to that before. Allow funds to be repurposed, extend your reporting deadlines, simplify your processes to the greatest extent possible. If you provided sponsorship dollars for an event that didn't happen, allow the organization to keep those dollars and use them for something else so they can keep operations going. Some of this would be, a plea under the best of circumstances. Simplify your applications and reporting requirements. All this kind of stuff can go a very long way. And I know that many of you have already done this, and thank you, thank you, thank you. That stuff is really, really important. Stability and investment. Again, I know many of you have already reached out to your nonprofit partners and said, we're here for you and let us know what you need. And again, that, especially in this uncertain time, that's really, really critical. The other thing I would say, and some of this is a lesson learned from some of the past crises that we've had to weather. I mean, since I've been working at the center, we've been through 9/11. We've been through the financial collapse of 2008. We've been through Sandy and other things as well. And one of the things that we've kind of learned the hard way is it's natural for funders to sometimes want to redirect their funds to the cause at hand. That is natural, and to some degree the circumstances require that. But there are pressing pre-existing needs that aren't going away in our communities while we also scramble to address this crisis. So that's something I would just urge you to keep in mind. It kind of goes back to the last slide about payout rate and trying to find ways to invest more in the community, and of course keeping an equity lens and mindset in mind as you are pursuing your work. I know that the council is very committed to that, but again, it bears repeating. Communications guidance, this is not just about philanthropy. A lot of it has to do with government. A lot of it has to do with associations, umbrella groups like ours. Nonprofits are scrambling. They're looking for clear and consistent guidance. And sometimes right now, when things are unfolding so quickly, it's hard to come by. So we are doing our part to try to connect organizations with that kind of guidance. But anything that philanthropy can do, I know that you have a history of doing a lot of this stuff really, really well. So connecting with discussion groups or other resources, helping organizations tap into information. We've created some resources, and I'll get to that a little bit later, but philanthropy is great at doing that. And I know you have a disaster playbook from Sandy, which is a tremendous resource, and much, much more. But also, intermediary organizations, capacity builders also need support because they're trying to help organizations to keep in operation, to navigate these, the legal framework, the compliance framework, the HR, the advocacy, and so much more. So again, just a lot of different layers to this. Partnerships, again, a lot of you have already reached out to your grantees and partners just to say, I'm checking in. How are you doing? What do you need? I know some of our funders have already done that. Many of our funders have done that, and thank you. Um, Grantees, partners need to know what you are thinking of in terms of your own response to the crisis. You are already, of course, coordinating with each other and planning joint activities and things. And also, there are groups on the ground that can use a shot in the arm, but also are helping coordinate this stuff on a daily basis. And obviously, the degree to which you can interact with them and help to connect them is also important. And we're all in this for the long haul. So the mental health and stress management aspects are obviously going to be key on so many levels, the front lines for the mental health organizations, but also as all of us navigate this and as we work on coping. Professional assistance, this is things like navigating the insurance and risk management world, looking at technology. Not everybody, some organizations can't work at home because either they don't have the equipment or they don't have the expertise. Some of it, again, is related to equity and capacity in other ways. Nonprofits are looking for insurance guidance. They're scrambling about whether, let's say, their event cancellation policy will actually cover virus outbreaks. How do we work together on rebuilding? There's a lot of professional assistance that can be had out there in the community, and whether we're looking at skills-based volunteering or the capabilities you may have within your own shops, your own company, your own foundation, there's a lot of that guidance that's going to that's going to be needed now and in the long term. So if you can't provide these things directly, help direct grantees to them and tell us at the Center for Nonprofits so that we can share that with the community as well. Wanted to spend a little bit of time telling you what we've been doing so far. Again, our response and our strategies are also unfolding. We're going to be having our own board call on Wednesday, and we'll be talking a lot more about immediate and long-term strategies and the best role for the center. But what we've been doing does cover a few different classifications. First and foremost, news and updates, trying to connect organizations to what's going on, passing along the resources as we become aware of them. Other things around advocacy, training, convening, and partnering. We have set up a web page on our site for COVID-19 resources. We update it several times a day. It has funding opportunities that we know of. It has links to government resources. It has links to, of course, the CDC and the state and up-to-date information, HR stuff. Anyway, it's pretty comprehensive, and we're working on more of that. So any resources that you would like to see there, please tell us and we'll add them, but also if you find it useful, please connect your partners to it because we're trying very hard to keep organizations informed. On the advocacy front, things have been changing rapidly, certainly working with the National Council of Nonprofits and other advocates in DC, and of course with the Council of New Jersey Grantmakers in DC and here in New Jersey, to make sure that whatever is coming down the pike, and lots of legislation has already been passed or is close to being signed, but whatever emergency actions are taken, whatever stimulus programs are developed, that the nonprofit community is included. If they don't hear from us, then it is just too easy for things to be crafted in a way that will leave the nonprofit community out. And there was a letter circulated on Capitol Hill that we also linked to in one of our letters to leaders here in New Jersey, just to outline some specific proposals about how to do that. But obviously government is key. Government investment in a big way, and we need to make sure that nonprofits and the populations that nonprofits are serving and people in need are not being left out. We have launched a new television show in partnership with Princeton Community TV. We have actually taped 3 of these episodes. The one we taped just the other day was on COVID-19, impact on nonprofits and some strategies. It's a half-hour show. It airs first on Princeton Community TV, and then it will be on video channels. I bring this up because the COVID-19 episode will air again next week, but also If you have particular suggestions or ideas for topics to cover, we will be doing this on an ongoing basis, not just about COVID-19, but about other things. So please send us your suggestions about that. We do think it's going to be a promising way to get the information out about a lot of really important topics. This is the preaching to the choir slide for this group, but I just had a presentation a couple of hours ago with the Office of Faith-Based Initiatives and Pro Bono Partnership, and just wanted you to know that we're also, along with many of you, still trying to impress upon people how vitally important the census is now, especially when the virus and the health measures are putting some other strategies at some risk. So we're trying, like others, to push out the point about the importance of completing this online, completing it early, given how much is at stake. Again, that's kind of the quick and dirty about this survey and what we've been seeing so far. I know this is part of a much, much longer conversation. I will reiterate that we are going to be repeating the survey at regular intervals. I'm not quite sure yet at what interval those will be, but we want to stay on top of this. We want to make sure that we know what's going on in the community so that we can all partner better to weather this together. These are our social media feeds. Please follow us if you are not already. Sometimes we can get information out a lot more quickly on social media than we can on the website. So just be sure you're plugged into all of those channels and work through the council. Again, we are proud to partner with you. We're honored to partner with you. Thank you for all you're doing in the community and the support. And I am happy to answer questions, and what I can't answer, I will certainly follow up with. Thanks.
Thank you, Linda. First, I just want to say this is Anna Council. I'm sorry to everyone who couldn't log on to the web or was having trouble logging onto the web, but we will have the slides available after the call, and we're also, the slide deck will be emailed after the call, in addition to having it be recorded as well. So Linda, if you don't mind sending your slides like in a PDF.
Of course.
Great. So now if we have any questions for Linda, I would ask that you please put it in the chat box so we can, and you can send those directly to me. I'll read those out loud. And if you are on the phone and you have a question and you cannot enter in the chat box, you can email Craig at craigweinrich@cnjg.org.
And Anna, let me know when you'd like me to stop sharing my slides.
Okay.
It's the little things.
Any questions? We'll give it a few minutes. Okay, here's one. Okay, so with the government focus on small business, nonprofits being supported to know about the resources and how to position themselves to get those dollars.
You were cutting out a little bit, but I think I heard the gist, which was a lot of focus on assistance to small business and how can nonprofits tap in. Is a very interesting and timely question. We are trying to put out those resources as we become available. I will be honest that we just learned this morning that there is some inconsistency with respect to some of the SBA information that has been put out. The high-level press and everything in terms of coming straight out of SBA has said that nonprofits would be eligible for COVID-19 relief by way of loans that would be at a 2.75% interest rate versus the 3.75, I believe, for for-profit small businesses. Unfortunately, we also became aware of guidance that SBA had put out through a webinar slide deck that said that charities and religious organizations, which is essentially the 501c3 community, are not eligible for that assistance. So we are trying very hard to get some clarity there, and to the extent that that is accurate and was not simply a misstatement by somebody who put the slides together, we are we're working with the National Council of Nonprofits and certainly many other advocates to try to push change for that. But that's been the mantra, that's been the message that we've been trying to hammer home on the federal level, with our partners in DC, and on the state level, that if you're talking about small business assistance, you need to include the nonprofit community. The other thing I will say, which is a little bit more encouraging, there is a bill on the governor's desk among the whole package that the legislature has passed that would provide for EDA, Economic Development Authority, New Jersey Economic Development Authority grants and loans, and nonprofits would be eligible for those. Obviously, it needs to be set up and all of that, but the legislation is crafted specifically so that nonprofits would be included there. So that's, again, we're careful about what we're putting out about SBA because we're not quite sure where where that lies. But we will put out anything we know as soon as we've got something conclusive. And if you hear of anything and can pass it along to us, please do that as well.
Great, thank you. Do we have any other questions?
I have a couple from emails that I've received, and since Linda was just talking about advocacy, there's a question to understand more of what you, Linda, and your team are doing related to advocacy of state leaders and the governor's office. We know that decisions are going to be made quickly in the next couple of days, and several grantees highlighted their need for coordinated lobbying, understanding those limitations to make sure that nonprofits are included in those government assistance programs. So do you have lobbying support, and what are your needs in this area? And how are you engaging other nonprofits who have strong, trusted relationships with state leaders?
Thank you for that question. A few things that I just want to highlight that we've done so far, and again, because this is moving so fast, we've been kind of I won't say partnering with, but we've been in touch with some individual organizations as opposed to being able to call out, the grassroots alerts that we sometimes do. We did send a letter, which you might have, and have been following up on it, but you might have seen this letter that we sent to Governor Murphy, Lieutenant Governor Oliver, and leaders of the legislature to reinforce what I was essentially saying, that nonprofits need assistance immediately. They need flexibility with respect to contracts. They need, so that they're not penalized when they can't meet their levels of service, for example, due to the virus, to ensure that nonprofits are eligible for any of the small business assistance that's coming down the pike, that nonprofits are also eligible for any unemployment insurance changes or credits that come down the pike for paying unemployment claims. We have, as you know, before this happened, been championing a charitable giving incentive because nonprofits were already being hit due to the federal tax law changes. That's something that we still think is very, very important. So, that's some of the specifics as far as some of the things that we've been doing. And I'll send you when I send the slides, I'll also send that letter so that you have it, and it will be linked to on our website as well. We have been in touch with a number of organizations who have been helpful in terms of reinforcing this message. I will say there have been some very encouraging developments with respect to either some specific populations that have been, or types of organizations that have been getting some relief, but also the fact that nonprofits have been included and that certain departments have made a point of saying, we are going to be flexible, we're not going to penalize you, we're going to extend deadlines, all of this kind of stuff. The Lieutenant Governor, for example, the other day announced in the press briefing that her Department of Community Affairs, would advance their nonprofit partners an additional 25% of their contract amount so that nonprofits could continue to provide services to the community during this time. I know that Department of Human Services has also made announcements to try to provide extra resources. Those are just a few examples. What kind of help do we need? Again, anybody who's in a position to reinforce these messages and has those connections with leaders in the governor's office, with the legislature, please help us out with that. Let me know so that we can tell you more specifically what we've been doing. And again, capacity is an issue with us too. We're all working remotely, and we are a team of 4 full-time, 2 part-time. So anything that can be done to leverage these messages, and I know that many of you are very, very well connected, both with your nonprofit partners, but with leadership, that would all be very helpful. So I hope that gives you a little bit of hope that helps as an answer.
I have another question here. Have there been any announcements regarding aid to organizations supporting and housing people who are homeless? Several of our local organizations are under tremendous stress.
I will check and get back to you. I believe that there might be others on the call, and certainly some of our partners in that field specifically. I think that some of those announcements have been made, but if you resend me that question, Anna, when we go offline, we will be sure to follow up on that. There are a lot of those kinds of announcements. I know that foreclosure assistance or moratoria are coming, and eviction moratoria are in the works, either federally or discussion here in New Jersey as well. I don't pretend to be an expert on that piece of things, but I will certainly follow up and tell you what I find.
Great, thank you. I think we have time for one more question. I do have some more questions in the chat, but I want to give people on the phone a chance. So Craig, you said you had other questions?
A couple of comments, but you talked about the homeless question, so that's great. One comment, zero interest loans for nonprofits are not ideal, and many will feel that continues that nonprofit starvation cycle. So just to keep that in mind as we go forward with any kind of government programs. Nonprofit organizations can also apply for pro bono projects on 2 different platforms. One is Taproot Plus, and the second is Catch-A-Fire. And our friends at Robert Wood Johnson Foundation have made that Catch-A-Fire platform free for New Jersey organizations, I believe, through the end of this month. I don't know if there's been an update from that for that being extended. So either be in touch with me, this is Craig at Council of New Jersey Grantmakers, and I can be in touch with our friends at Robert Wood Johnson Foundation to talk a little bit more about that. We've seen some successes with our members using that platform as well too. Then one last question, one that you sort of addressed already, Linda, but just to also highlight, are there other projects or assistance that you need with hands-on but high priority projects while the COVID needs are being addressed? For example, the census. Could we as Philanthropy call organizations and help people to step them through completing the census via phone or other activities?
The short answer is yes. Let me give some thought to how that might to what form that might play. Certainly the census is huge, and yes, we like others are trying to juggle our role in promoting that, as well. I'm just talking about the center specifically at the moment, our role in promoting the census and helping nonprofits to play a part in that, along with the immediate response to the COVID-19 crisis. As I said, we're going to have a board call next week, and I'll have a better sense of where, from a board perspective, where some of our needs and priorities are. The other thing I was going to say, which I kind of didn't mention, but we're also looking at trying to create some online discussion groups or some ways for organizations to convene and share information and needs and ideas and resources and coordinate. And I know we're not the only ones either doing that or thinking of it. So my request there is, if you are experienced with that, or if you know of others that are doing it, so that we don't reinvent the wheel, let us know what you're seeing about that as well. It's certainly something that our board is very interested in having us do, and I think we could have a really helpful role to play, but I'm mindful of the capacity impact as well as just the logistics of pulling it off. So I appreciate that question, and we'll get back in touch with some more specific ideas, but thank you for that.
Okay, So unfortunately, I don't think we have time for any more questions. So Linda, if you could stop your screen.
I will do that. The only other thing I will say, which I might not have, which is that we, the Center for Nonprofits, will be doing our own, another briefing, our own next Thursday at 2. We're still kind of fleshing out the focus of that. It will certainly not be the last one that we will do, but if you have things that you think you'd like to have us present there, let us know. But there will be more opportunity to get more information about from our standpoint there too. But I will stop sharing my screen, and thank you again for the chance to be here.
Thank you, Linda. See, hopefully, okay. Okay, so thank you very much, Linda. You know, some of the things that we've heard from our partners is listen to your grantees. What are they saying? What are their big needs? So that's, you know, one of the big reasons why we have partnered with Linda on that rapid response survey, and why we're grateful for her coming on the call today. Next, we're going to hear a little bit from Kevin Callahan, our Newark Philanthropic Liaison at the Council, and he's going to speak a little bit about early thoughts based on what Newark is doing and how the philanthropy and the local government is responding to COVID-19.
Thank you, Anna, and I will just say a few thoughts in terms of what we've done to date and where we think we're going, although this is obviously ever emerging. So number one, I think, you know, what's really important to state is that, you know, our funding community, core group of our funding community had a call very early on in this cycle, sometime last week, to talk about potential responses. At the same time, they were already considering creating a fund to support Newark and the greater area, and what that might look like to be most supportive. This past Tuesday, we convened a much larger call and webinar with our Newark funding community. On that call, we were joined by Catherine Wilson, who will be hosting a fund for the greater Newark area at the United Way of Greater Newark. We were also joined by Dr. Janice Rogers from Rutgers University. She chairs our homeless commission in Newark, as well as the Believe in Healthy Newark initiative at the United Way. And we were also joined by Superintendent Roger Leone to talk a little bit about the school district. So we were really trying to get as much of a 360 view as we could on things that we should be thinking about. I also had a chance to engage with our health department director, Dr. Wade, and some city leadership to get a sense of what the city might be thinking about during this time. And so we had that briefing on Tuesday. We are going to continue to have those calls on a weekly basis. We understand that this is an ever-evolving issue, but also that there are a lot of affected stakeholders that we want to hear from. And so we're planning on using those calls to hear from different populations. So, you know, we might do a call on hearing from some nonprofit leaders. We might do a call hearing from some folks on small business and how small business is impacted. We might do a call on policy. So it's really something that will evolve over the next few weeks, but I think it's a good practice just to keep everyone in the loop and informed. As I said, the United Way stepped up very early, and I know Catherine is on the call, and thank you to Catherine, and we're already engaging our funding community on bringing in dollars around the fund, and I'm sure she'll talk a little bit about what that fund will include, so I'm not going to go too much into that. But you know, something else that I want to highlight is we've really been able to coordinate public and private. So there was an interest from Invest Newark, which is our economic development nonprofit in the city, in creating a small business fund to support our small businesses in the city. I was able to link those two organizations. So the United Way and Invest Newark are now working together on a small business fund. So that small business fund will be separate from the main fund that the United Way has created for all basic needs, but still a way to coordinate philanthropy and have it at a bird's eye view, which I think is very important at this time, and also important not to have multiple organizations, particularly in one city, you know, trying to go to foundations with different requests. I think at a time like this, it's really great if we can have that 30,000 foot view, or if someone is managing that 30,000 foot view. So I thought that was very helpful. We've done the same with the arts. So, you know, the arts organizations obviously are very concerned at this time. We have a very strong arts community. We have Newark Arts with Jeremy Johnson. We have an excellent director of arts and cultural affairs at City Hall in Newark named Fahmi Shakur. So we connected them with the United Way as well, and we're talking about how you know, we're thinking about funds for artists as we do this. So we're trying to be as inclusive as possible, you know, in that conversation. You know, so I think, you know, again, just this conversation about bridging philanthropy and the public sector has been very important to us in Newark. One thing that we're exploring right now, particularly on the small business side, you know, Newark has gone, I think, farther than a lot of other places quicker in terms of closing almost everything. And so Mayor Brock is very concerned about a lot of our small businesses on Broad Street and throughout the city that, you know, are truly just, you know, one or two folks that are operating those and running them, and they're going to have a very disproportionate, feel a very disproportionate impact. And so, you know, the city is interested in putting up some public dollars to possibly support them. And so, you know, right now we're seeing how we can put together a public-private partnership to support some of those organizations. And I'm sure that there will be a lot of other examples as we move forward of opportunities to connect the public and private sector, whether it's the school district, the city, you know, individual needs, small business needs, et cetera. And so, you know, I think that at this time, it's just good to have that level of coordination and support for fund development, so that we ensure that we have the resources necessary for all the folks in our community who are going to be impacted during this time. So I'm connected in on a daily basis with city director calls, and I'm able to share with our funding community the needs as they arise. And like I said, we'll be doing that phone call every Tuesday morning to stay engaged with each other. And then I'll probably stop there if anyone has any questions. I don't want to go too far on the fund, because I want to make sure that Catherine has a chance to talk about what the United Way is doing and what they're thinking in terms of how to use the fund resources and what we're hearing. I mean, the only other thing I would add is obviously, you know, the basic need element of this is huge. You know, getting people cash is very important. And you know, that was not necessary. This is not necessarily a new thing, but it's definitely something that COVID is bringing into the front burner, that our folks are living under tough financial constraints, and this is going to make it even tougher. And so taking care of some basic needs and looking at getting cash into people's hands is just something that is critically important.
Oh, can everyone hear me now?
Yes.
I can hear you.
Okay, sorry about that. So thank you, Kevin. If anyone has questions for Kevin, again, please type them in the chat box, or send them via email to Craig if you were on the phone. I will check the chat now. Sorry. Okay. Craig, do you have any questions coming in through email? No? Okay. Okay. Well, if anybody has any questions about Newark, what Newark's doing, Kevin, can they contact you? Maybe he's on mute.
Sorry. Okay. Yes, absolutely. And obviously, it goes without saying that anyone who is interested in contributing to the fund or talking about the fund and how it's going to be working in the next few weeks, please feel free to contact me, and we can definitely touch base on that along with Catherine.
Okay. Thank you. And also, I just want to note that there was a question about if there's going to be a governor's fund or any statewide fund. And Catherine actually answered saying that the First Lady is setting up a statewide fund. So with that, I'm going to thank Kevin, and I'm going to go on to Catherine to speak about her work at the United Way of Greater Newark, the fund that they're setting up. Oh, he's still on. Okay, you're muted now, Catherine. Sorry about that.
Can you hear me? Sorry,
Yeah.
Can you guys hear me now? Okay. I don't have a microphone on my computer, so I actually dialed in to the phone. So we actually set up a fund, a regional fund for our partners on the ground. We actually cover 13 municipalities here in the greater Newark area, and wanted to make sure that folks understood that, Irvington and the Oranges obviously had just as many needs as Newark. So the structure of our fund, and if you haven't seen it, there is a document. I'm sure Anna can send it out to everyone if you're interested in seeing it. The structure of our fund is based on the 4 phases of disaster response that have been set forth by FEMA. We structured our Sandy Fund after this. And so basically right now what that says is that there's a preparedness phase, a response phase, a mitigation phase, and a long-term recovery phase. And so based on that, we sort of picked some buckets around where we thought the needs were initially, and then scheduled a series of conversations with our partners where anyone could join in around 3 specific topics. The first topic was around serving vulnerable populations. As has been mentioned many times, this particular instance exposes sort of the even wider equality gaps in our country, and we wanted to figure out how our nonprofit partners were responding to helping to support the vulnerable populations, including the homeless, the elderly, people who obviously are in the lower income bracket, et cetera, et cetera. We also hosted a conversation on Wednesday, understanding nonprofit operations during this time. We understand folks have, gone to virtual, but as Linda mentioned earlier, there's a lot of organizations who simply couldn't do that. And so, what were some of the disruptions and operations and the funding needs in that area? And then on Monday, we actually decided to host a conversation with one of our technical assistance partners on helping nonprofits connect to their donors during this time. As Linda mentioned, a lot of us, including United Way of Greater Newark, had to cancel a fundraising event. And so we have a technical assistance advisor on fundraising, and she's going to be doing a 1-hour presentation for folks on how to connect to your donors, how to communicate about what you're doing at this time, and how to continue to raise money as we all do. So the basic buckets of the fund include providing for basic needs, public health needs, long-term recovery needs, as well as nonprofit needs, operational needs. And as Kevin mentioned, we have a separate carve out for small business. And on Monday, I have a call set up with the artist folks to carve out funding if anybody wanted to designate funding towards artists. So around the individual needs relief, all of that funding will go to one of our nonprofit partners on the ground. And that includes obviously food, rent, utilities, that type of thing, as folks' income has been disrupted by COVID. In terms of the operational needs, we had calls with several of our partners who've talked about some of the budget gaps. Again, as Linda mentioned, we're always in this, cycle of trying to catch up. For example, one of our partners operates a public-facing building. They did not obviously have it in their budget to hire a professional cleaning company, but they have to do that in order to continue to serve the public. They don't have that in their budget. So that's one thing that some of our partners are facing. On the public health side, some of you have heard me say this before, we're trying to provide some wraparound services to our medical staff. Spoke to the president and CEO of University Hospital earlier this week, who talked a little bit about how some staff are actually having to call out because they don't have childcare. So trying to figure out how we can set up services and partner with them to find some solutions on that, as well as they have an issue with they particularly have an issue with their cafeteria being able to serve their staff 24/7. So again, partnering with them and thinking of creative ways to be able to have food brought in from the local restaurants to support medical staff who are on the front line. So as this has evolved, we have created an advisory board. There is a funding level in order to join the advisory board for us. And then our technical assistance partners in very specific areas are also on our advisory board. So for example, many of you know her, Dr. Denise Rogers is our public health advisor, and she also is the homelessness commissioner for the city of Newark. So she kind of is wearing a couple of different hats for us. Burnell over at Invest Newark, and Burnell Hall is our technical assistance advisor and is partnering with us and the city around the small business fund and setting up the criteria for that. And then the chair of the United Way of Greater Newark board is also on our advisory board. We are in the process now of updating our website to create a one-page rubric that if an organization is looking for funding based on one of those buckets that I talked about, they can fill out that one-pager, submit it to us with their 501c3 status, and then we can make a determination based on the total amount of money we have, how much we want to put out there. So for example, we anticipate looking at the total pot, determining how much we should put towards basic needs, how much do we need to put towards public health, et cetera, and then making determinations from there. The other option for a funder is to designate their gift towards a specific area. So for example, one of our funders had a couple of different organizations she wanted to designate funding towards. We had another funder who had a carve out for another specific need. So we are capable of doing that as well. I think I'll pause there to find out if there are any questions on that.
Thank you, Catherine. I did see one question come up. It says, would be great to know who all your partners are in the 13 communities where you are working.
So I can't do that off the top of my head because there's simply too many of them, but I'm happy to put a list together and send that out to everyone.
Great, thank you. Does anyone have any other questions for Catherine? We'll also hear from a couple other members to see what they're doing. So there'll be time for questions at the end as well. Craig, are you getting anything on email? No? Okay, well, let's see if some other questions pop up, but I'm going to keep us moving so to make sure that we hear from everybody. So next, if Andy, if I could switch it over to you, Andy, the Executive Director of the Community Foundation of South Jersey, is going to tell us about what they're doing in the response to COVID-19 in the state.
Thanks for the opportunity. Thanks to the council and the center for being part of this and sharing this valuable content today. I also want to flag and a appreciate the work of Eric Estrada on our staff, who's helped me think through this strategy, and Lois Greco from our board, who I also know is on the call, who's helped think through this strategy. A lot of this work is driven by our community leadership and engagement, our community engagement and leadership committee at the Community Foundation. And I won't name all of those persons, but also want to recognize their leadership in helping us think through this. We likewise have put together a response fund that recognizes both the public health crisis that this is, but also the economic crisis that this is creating. And felt like it was within the Community Foundation's ability and bandwidth to convene funding partners and be able to respond to the not-for-profit sector in support of our neighbors in South Jersey who are directly confronted by this pandemic. So we've created a fund, a response fund, that's putting a priority on meeting the needs of South Jersey residents through local not-for-profit partners who are on the front lines. And we feel like as those trusted partners are best prepared to meet the wide range of needs that are exhibiting throughout the South Jersey region. Those not-for-profit agencies we know are going to have to adapt both internally and programmatically to assist neighbors and clients and new clients as this crisis affects everybody. So what we're planning to do is make a number of one-time program support grants, starting at least $3,000 to local nonprofit organizations that are engaged and doing work in the 8-county region. For us, that's Atlantic, Burlington, Camden, Cape May, Cumberland, Gloucester, Salem, and Ocean counties. We're anticipating multiple waves of funding through the fund. We haven't publicly announced this yet. I'm still securing funding commitments, and I've got at least 10 active conversations at this point with funders who are interested in pooling their resources with us to make an impact in South Jersey. More details will come. I want to call it out. It's not active yet since we haven't publicly announced it, but everybody take note that the website for the fund is southjerseyresponse.org. And I'll put all of this information up there, and it will be publicly accessible once we publicly launch early next week with some initial funding commitments. We're looking to align donors, obviously, from neighbors supporting neighbors in South Jersey. Part of our call to action as we launch this thing will be in this time of difficulty. Here's a way you can support your community at large, but then also amongst our own fund holders at the Community Foundation and other partners in private philanthropy, recognizing that we can do more together than we can individualized strategies. We've prioritized the funding along 3 phases that we know we're going to have to adapt to and evolve as we raise resources and as this crisis evolves in terms of impact. Immediate phase 1 response is triage. Immediate ability to respond to community-based nonprofits that have seen increased demand from services from residents due to COVID-19, focusing on providing critical supports and economic security types of activities. Mortgage, rent, loss of job, childcare, the things that are just having real detrimental impact in communities and with South Jersey residents. Phase 2, what we call treatment, grants for local nonprofits that are having to modify their service delivery modes as a result of the response to the crisis. I'll give you an example here. One of our partners at a Boys and Girls Club in South Jersey talked about what they've had to do both to eliminate staff, thinking about modifying how they deliver programs once we move past the self-imposed isolation, how they might deliver services into the future with this new reality of COVID-19. So local youth centers, childcare, senior services, adult daycare, community-based education programs. We know all of our partners are having to think differently about how they work and how can we support them as they do that work. And then if we're successful, as we hope to be in the fund, recovery efforts. we know, much like Linda's conversation, that local nonprofits are either because of their strategies are changing and they charge fee income, or they've had to cancel fundraising galas and whatnot, that they're going to be hard strapped for resources. And so if we're successful in generating the types of an investment pool that we want here, we'd like to be able to invest in sort of that phase 3 recovery strategy. So what we have said is we will not do a big formal application process. We're trying to be very responsive and very nimble in this as it emerges. So we're identifying some early partners on the ground as we secure funding commitments, but we've also created a way for nonprofits who either we don't know or want to make sure that their needs are on our radar to just submit no more than a 1-page document that talks about their mission and the impact that the crisis is having on them, so that we can better understand it. And we've created an email address, covid19@communityfoundationsj.org, where they can share those details with us. As I said, this work is very much being workshopped with our not-for-profit partners and led by our community leadership and engagement committee and the other philanthropic partners and fund holders who are coming together in support of it. So we'll actively identify grant recipients and then make funding decisions with those partners. We'll do it on a rolling basis going forward throughout the outbreak and the recovery phase. We want to get resources on the ground as quickly as possible and recognize that we're going to have to evolve in subsequent phases of the work as the impact of this thing evolves alongside of us. So appreciate all the resources too of the council and the center in helping us think through the best way to respond in South Jersey. So that's where we're at.
Thank you, Andy. So I'm going to ask if anyone has questions for Andy or Catherine or Jeff, who will speak next. You could continue to put it in the chat, or if you were on the phone, actually, if you can email me at anna.dalia@c.org.
Actually, I'm back on.
Okay, never mind. You can continue to email Craig. He was frozen for a minute, but he's back. Okay, so yes, please, I'm going to keep things moving. But if you have any questions for any of the members who are speaking about their efforts right now, continue to email them to Craig or write them in the chat, and we'll ask them after we have Jeff speak. So right now I'm going to ask Jeff Vega, the President and CEO of the Princeton Area Community Foundation, to speak about what the Princeton Area Community Foundation is doing, the fund they are setting up over there. And make sure.
Okay. Can you hear me, Anna?
Yes.
Well, let me begin by thanking you, Craig, Maria at the council, and Linda at the center for hosting this webinar. For those of you who may not know, our mission as a community foundation is to promote philanthropy to advance the well-being of our communities forever. We are sort of the hub of working with donors and philanthropists, advising their charitable giving, more often through donor-advised funds. We have and host about over 400 funds. Last year, we issued about $17 million in grants, mostly from DAFs. We also host nonprofit funds, funds from nonprofit organizations. We have about over 60 nonprofits that have about 90 funds with us. We also support very wonderful grant-making programs. We have the Fund for Women and Girls, a group of over 80 philanthropists, women and some men, who come together to raise money for to grant to nonprofits addressing issues mostly with women and girls who are economically disadvantaged. We also host the Bunbury Fund, and there are a group of advisors that lead the work of the Bunbury Fund, focused on building capacity, funding the capacity building of organizations, issues like governance and strategic planning and technology. And we also have the Next Gen Fund, our newest fund, a group of millennials coming together. We also have discretionary funds. About 17% of our assets belong to us. Some of you may be familiar with our work on All Kids Thrive. That's our work working with school districts in our region to address the issue of chronic absenteeism. And we also host the Community Impact Grants. That's our responsive grant making program where we fund about 16, 17 nonprofits on a multitude of issues like food insecurity, mental health, economic development, all with the framework of addressing issues that impact low-income families and communities. We've also done special projects, like recently funded 4 organizations to address the needs around the hard-to-count population with the census. What we've done is we were compelled to act given this crisis. Given that we're ideally situated, having a lot of relationships with our fund holders, with private foundations and corporations, we united a lot of our leadership and our funders and supporters and asked them to really come together to create our COVID-19 Relief and Response Fund. It's been a lot of work in a very short period of time. That in a couple of days we were grateful to raise about $1 million, including $250,000 from our organization. Most of our funds were committed to our existing grant making programs, so our board took the historic move to exceed our annual spending limit and dip into dollars to seed this fund. And we also want to acknowledge the Betty Will Johnson and the George H. and Estella and Sands Foundation, as well as the Bunbury Fund, NJM Insurance, the Burke Foundation, and the Fund for Women and Girls, who rallied around to at this time of crisis. So we've raised dollars. This is the beginning. We are having more conversations with other donors who will come into the fund. We are feverishly working to put together the grant guidelines, but echoing what Andy said, usually what Andy said, and that is to be nimble, and that's what we're going to do. Usually from our grant making programs, we're looking to learn. While we will learn from this experience, now is not the time for that. What we want to do is to get the resources out to our nonprofits who are on the front lines right now dealing with adapting their programs to meet the current needs, from everything from feeding. We just heard from the president of the Board of Education in Trenton that from a third to half of their students do not have the laptops to continued engaged learning. One of the things that we've done 2 weeks ago, much to Linda's point, is to look at our current and existing grant making and see how we can make that more fluid. We send a communication to all of our All Kids Thrive grantees, letting them know that this was going to disrupt their program design and that they had every latitude and support from us to rethink their program design and make sure they're being responsive and helping children remain engaged in learning. So we're going to look to our current funding programs, seeing how fluid they can be, and as well as launching this fund in the next few days and being nimble and responsive. And we are already hearing from a lot of our nonprofit organizations on the ground about what they need and trying to respond to that, as well as communicating with government leaders, for example, the Director of Human Services, Mary Grace Billick, and the kind of coordination that they're doing so we can support each other. I have a call set up with Sandra Toussaint. We've been from United Way, we've been in communication. So there's a lot of coordination trying to make impact. And we are, the only thing that's for certain is the uncertainty and anxiety that our nonprofits are experiencing. And our role will be how to remain as responsive and nimble as possible. So I'll stop there for questions.
Thank you, Jeff. So I have a couple questions, and some of them are for Newark, so I'll ask that one first and then go into it. The first question I got was, I noticed that a lot of the info shared about the coronavirus response is mostly in English. How is Newark meeting the info needs of non-English speaking communities? Although I'm sure this applies to your communities, Jeff and Andy too. So does anybody want to share? I will unmute Catherine and Andy as well.
So I can sort of speak to that. In Newark, we are part of a collaborative called Believe in a Healthy Newark. And again, Dr. Rogers chairs that collaborative. We had a call this morning with Rutgers School of Public Health to sort of identify some health messaging around washing your hands, how to wash your hands. All of that information will be on our website in Spanish, Portuguese, and Haitian Creole. We're also going to actually print posters to send to the grocery stores in other, pharmacies and our nonprofit partners in different languages as well, around, again, sort of some of that health literacy stuff, how to social distance, what is social distancing, mostly all the stuff that's coming out of the CDC at this point.
Thank you, Catherine. Another question I got is, does anyone else want to address that, Jeff or Andy?
I would just say point well taken. Certainly, we've done one strategy document at this point, which is sort of our message behind this. And as we go public with information where there's immediate connection, we'll certainly make sure that there's translation available.
Anna, can I just add that, and I see Jeremy actually typed it, but the mayor is doing daily Facebook Live updates with the health director. And there is an American Sign Language person there, and then after he speaks, they do it in Spanish, and I believe they're going to also do it in Portuguese and Haitian Creole, and that's a daily thing. It's on the local channel 78, but it's also on Facebook Live.
Great. Okay, so another question we got is, what is the logic/precedent for establishing the grant size in many of these emergency response funds? Example, one-time operating grants of 5,000 max. How do you determine a meaningful size for a variety of groups?
I'll speak to that. There is no right formula. This is about listening to nonprofits, what they need. I anticipate that with our response, we'll be making large funds, not large grants, and we'll be making small grants. It's about listening to them and asking questions about what they need. And in some instances, they may, I've already had a conversation with one nonprofit that what they'll need money is just to purchase food because they project that they're gonna run out. So just understanding what they need and then acting accordingly. Again, to the point that's been already made, it's being nimble and being flexible.
This is Sandy. I would just say here.
Oh, go ahead.
Sorry. I would just say here, Lynn, the same spot. And Eric from our staff actually put a note in the chat as well to say, in some ways, there is no right answer. We likewise want to be nimble, but also recognize that the more we can raise in support of our partners, the more we can provide larger grants and provide more flexibility. So we went to a minimum size of investment of $3,000 in our fund strategy. Again, and we'll partner with the organizations we ultimately make grants to as we raise additional dollars to figure out what's possible.
Yeah, just echoing that. I mean, I think that's really how we've determined is based on the actual total amount of money raised. Again, being flexible, we'd love to be able to say, sure, we'll give every organization $5,000 or $10,000. I don't think we have the capacity to do that currently based on the amount of money raised. But as more funding comes in, certainly we hope to help as many, obviously, folks as possible.
Great, thank you. Craig, are you getting any questions via email?
Yes, I've got two for Catherine, one short one, one a longer one. So the short one is, what is the funding level for the advisory board opportunities? And the second one is, it sounds like you're ramping up very quickly. So how is the United Way doing in terms of capacity to manage all those programs?
So the advisory level for our fund is $500,000. We have 2 funders right now at that level who have joined the advisory level. In terms of our own capacity, what we've done is, we have a small staff of 10, so we have again, partnered with our technical assistance advisors in the community to help us figure out how to sort of triage needs and then deliver, virtual programming as needed. Again, so for example, Burnell Hall over at Invest Newark has been instrumental in helping us design the small business criteria for the fund, and they will help administer that. I'm leaning on Jeremy Johnson. We have a call on Monday. I will lean on him to help us determine the programming and funding criteria needed for the arts community. So we basically have someone from every sector who's sort of helping us to carry out and deliver what we needed. And we've specifically asked, and in some cases, folks have stepped up to help us. And so that's been tremendous.
Great, thank you. I have a question, and I don't know if it's just to everyone in the chat, but it's, would funders consider creating a statewide collective database of grants awarded so we can enhance coordination? Has that been anything that has been discussed that anyone, Catherine, Andy, or Jeff, you could speak to?
I would speak to that, putting on my hat as a board member at the Council of New Jersey Grantmakers. I think the council would be ideally situated to collect that data from all funders in the state and be able to create that database.
Mm.
Sorry to create more work for you, Anna.
Glad that that's something that people might be interested in. And again, we're saving the chats, so all of this information is going to be sent out to people afterwards. Craig, do you have any other questions coming in via email?
Not for this section.
Not for this section? Okay. Okay, I'll give it another minute. If anyone wants to ask a question to Jeff, to Catherine, to Andy, or just to the group, please continue to enter it into the chat box or send it to Craig.
So this is Maria. I want to take a second and just thank Anna for pulling all this together, and the presenters have been amazing. I think this is a good time to put in a plug. I like the idea of a couple of things. One, the issue of having a statewide coordinated database would be great if we could pull that off. I think we should also let our members know that we have set up a listserv that's, Craig, give me the exact title of it now. Is it COVID-19 Funders Listserv?
COVID-19 funders at lists.cnjg.org. I will type this in the chat box. Everybody that has registered for this, that is a funder, is automatically put onto that listserv. Mm-hmm. You should have gotten a couple of ones already. Yesterday from both Teresa and I about a couple of different information there. We encourage all of our members, if they are doing something new or have a question about this, to continue the conversation using that listserv. And also just want to plug our webpage that lists a good amount of resources, including all of Linda's information on our own website that's specific to the coronavirus outbreak.
Mm-hmm. The other thing is this was a chance to hear from 3 community champions that have really taken this on. And I know a lot of you are also involved in this work. And while there wasn't the time to talk about it here, I think it's important to continue the conversation. So one of the things we did want to ask that we imagine will be okay with everyone is to try to set up at least a weekly call so we can kind of be updating what is happening in the community, what other funders are interested in engaging in, and even look at the information that Linda shared with us and see what other issues are coming up in the process. I'm assuming everyone would be fine with doing that. In essence, we want to go back and look at the model that we used during this Superstorm Sandy and develop a way to stay connected so we could keep each other informed and engaged in as things develop.
Yeah, if I could build off of that, Maria, this like a weekly standing call, the purpose of that would be to gather, it would be on different learning topics, working with our affinity groups and our, the other leaders at the council to try and identify certain topics that we want to have more in-depth conversations about. So whether that be, relating to the arts or relating to homelessness, and have speakers from our different partners speak about that, and then have time for a funders discussion on that topic. So if there are topics you want to hear about, or you're an affinity group co-chair, I know our Camden co-chairs are talking about doing something as well. So, if you're a co-chair or if you have a topic in mind that you really want to discuss, let us know, and we can try to establish that in this sort of weekly standing call.
I also wanted to just note here that we've been monitoring carefully what our partners have done around the country, and all of the information that was shared here by all our presenters, including Linda, are very much on point with what's happening in the country. So we're right there at that level. So I think that's really important for us to know that we are, the nation has the same issues we have, and we're trying to address them in a way that's coherent and informative to everybody. So with that, is there anything else you want to say before we close it out, Anna?
No, just to remind everybody that I will follow up with the our resource page for COVID-19, with information from the chat, with the slides from Linda, and some other resources that were mentioned in the chat and that our speakers mentioned today. But if you have any specific questions or anything that we can help you with, please feel free to reach out to me. And yeah, that's all.
So in closing, I just want to say something we probably should have said in the beginning, that we're so glad you were all able to be on this call. I hope all of you take very good care of yourselves. We can't afford to have any of you get sick because we need you now more than ever. So take care of yourselves, stay well, and we're all in this together.
Thank you, everyone.